Hello, everyone. Mike Mosquito with the Buzz Podcast, here on location this week with my wonderful co-host, Maureen.
Eileen.
And we're at the Texas Regional HIMSS Conference here in Dallas, Texas. We're on site with Julie Dearinger Smith of Contingency Health Solutions. Julie, you're in the Entrepreneur Lounge with us this week.
I am.
Are you enjoying this?
This has been wonderful. It's been so much fun and fun seeing all your podcasts as well.
Oh, well, thank you. Thank you. It's been fun to be in the room while everybody is mingling together and hearing the conversations happen around us.
This is a nice addition to a conference to be able to meet someone like you. Give us a little bit about your background and how did you become an entrepreneur and you have a product that needs to be shared with the world?
Thank you so much for the opportunity. I have been a nurse for 25 years. I've been in informatics for 20 years. And I have been looking, our company, which is Contingency Health Solutions, we've been looking at how do we safely care for patients with the assumption that your network is down for an extended amount of time. So looking back and talking to health systems that have gone through an extended network downtime, I heard several stories about patients who were given hotel check-in bills to ring when the nurse call system went down. And I did not realize the nurse call system could go down if your network goes down.
Oh, yeah.
Oh, yes. Yeah. So, I mean, imagine it's a stressful time. Nurses are trying to document on paper, really unsure of what to do next. And now they're playing Marco Polo to a bell that's ringing down the hallway. So what we've done is we've actually developed 2 applications that are client ready. The first is Contingency Bell Assist. It's a web application that patients can use with their own device. They can use over cellular signal because we're assuming your network's down. And you can actually select any of the options that the health system has set up. So for instance, patients can't just say, oh, I need help. They could say, I need a blanket. I need ice. I need my trash can emptied. I can optimize my workforce because I don't have to send an RN into that room to do that. And so it's actually one of the reasons why it's web-based is because it can handle any patient's language and it will translate for them based off their browser. It will go to a nurse view. So a nurse can use their own device. They can see all the patients that have their bells on. They can see why they're on. They can even see if a patient is a fall risk so they can prioritize that care as well.
Now, how is that integrated now? The fall risk, is there an alert or is there a warning sign? How does that happen at the nurse's station or on a nurse's device?
Yeah, so we can mark a patient in a room as a fall risk. Usually when nurses assess a patient as a fall risk, there are certain things that they do, such as maybe certain colored socks or a sat on the bed or a gown. So that is an additional step that they'll just mark that patient as a fall risk. And it actually shows on that patient's room. It says a fall risk.
Okay, very nice.
So I've been a nurse. Haven't been at the bedside for a while, but like you, informatics background. So always excited whenever I have a nurse colleague sitting next to me. Let's talk about downtime because Mike and I had this conversation, 2-3 weeks ago. It seems like when downtime events, irregardless whether it's cyber or it's planned or unplanned, downtime happens and we've got nurses that are now, and I called it gross panic because, oh my gosh, there's a patient in the bed, but the computer's down and I don't know what to do. And so your solution also has that component as well.
That's right. So we're at HIMSS. We talk a lot about technology. I think the technology team, they really have focused on cybersecurity and helping us to keep from going down. What we need is the operational leadership to get together as well and to be a part of that planning because IT is going to be busy bringing the systems back up, but it still could be 4 to 6 weeks.
Spin up very quickly. You don't need all the bells and whistles. You just want to be functional.
Yeah.
So we do that with your app.
That's right. There's actually some everyday uses for the applications as well.
Okay.
For instance, our ED's very, very busy, heavy census. A lot of times we'll build hallway beds. And as I worked with my team of nurses across the country, what we realized was with some minimal changes, we actually had a bed management system now too. Our transfer center can know which beds are occupied, which ones are unoccupied, which ones are dirty. EVS and housekeeping can focus in on what they need to do so that we can optimize turnover. And optimizing throughput when every system is down is really key for your health system.
Absolutely, because you want to let those patients that don't need to be there go to their next level of care.
Absolutely.
And you want to make sure that you allow the freedom for the patients that are coming in to have a place where they can be safely cared for, even during a downtime event.
Absolutely. It's key. Patients do not stop coming.
No, they don't. No, even if you put closed, we have a hospital, we closed it. Even with the closed sign on it, the patient still can't. Because you know what, you get used to it, and that's within the community. But it is true. At the end of the day, you will always have that influx, and it's scary time.
It is. A couple of things we built in and we always keep in mind is number one is going to be the ease of implementation. IT teams are busy. Also, education. It's a contingency application oftentimes. So we've built in education 30-second video for patients so that they can see that at any time, and team members.
So as you talk about this and bringing a system online, what have you sold to any health systems yet? Are you just brand new?
So we are new. We're client ready. I am talking to some health systems, finding our foundational partners. Currently, we do not have any PHI in our application. There's a good reason for that.
Oh, yes.
Number one, we need it to be to market as soon as possible because there's not a solution for this.
Yeah.
Number two, it's going to be easier for us to sign contracts with our foundational partners. But as soon as we've done that and we've implemented, we're going to start with the integration.
That's nice. And you want to be able to go as fast as you can, not being impeded or hindered by internal structure. You're a standalone application.
Absolutely. We're EHR and any system agnostic.
That's beautiful. So as we talk about technology that's enabling better workflow, better patient engagement, I think you've hit the head on the nail.
Nail on the head.
Is that what I was supposed to say?
I think so.
Thank you for correcting me. I got two nurses here. I knew one of you would correct me.
You have two women next to you. You knew that one of the women would correct you.
Thank you, Julie, for joining us today and tell us about your wonderful application. If you're in HIMSS Texas Regionals, you need to find Julie. She's in the Entrepreneurs Lounge. Or if you want to reach out to her, you'll find her on our website. She'll be listed under the buzzbuzzpodcast.net. And if you're here, keep buzzing, and we'll see you soon.